If you're considering a Medicare Advantage plan, you may be doing so because of the advertisements on TV and everywhere else. The insurance companies and their marketing teams do a great job of showing you the good side of Medicare Advantage plans, but they do leave out some important information. Hi, Joann Quinn, co-founder of REMEDIGAP.com and independent insurance agent. I've helped thousands of Medicare beneficiaries since 2013, and in this video, I'll tell you what the Medicare Advantage plans don't want you to know. Many people like the idea of a Medicare Advantage plan, especially someone who is healthy and rarely visits the doctor. The free Medicare Advantage plan can also include drug plan coverage and some additional benefits for dental and vision. And sometimes the Medicare Advantage plan will even give you money back. These are all the wonderful things advertised about Medicare Advantage plans. Unfortunately, there are more details not shared with you. Medicare Advantage plans have a limited network. You must use the insurance company's service network of providers. You can't go to any provider who takes Medicare. A Medicare Advantage plan can have an out-of-pocket maximum up to $10,000 for in-network and out-of-network health services, which will reset every January. So if you have chemotherapy, you pay the 20% coinsurance until you meet the max out-of-pocket, and then you start over at the beginning of the year with a new max out-of-pocket to meet. And a Medicare Advantage plan can require referrals, especially for time-sensitive issues like cancer treatment and medical tests. And this is a biggie. The insurance company sponsoring the Medicare Advantage plan has the power to deny your claims and prior authorizations, which was identified as a major concern by the U.S. Department of Health and Human Services. And they released a report in 2022 that found every year Medicare managed care organizations, known as Medicare Advantage plans, inappropriately deny medically necessary care to tens of thousands of people enrolled in private Medicare Advantage plans. Specifically, the Office of Inspector General reported that Medicare Advantage plans denied prior authorization requests and payment requests that met Medicare coverage and billing rules. The Office of Inspector General also reported that among the prior authorization requests that Medicare Advantage organizations denied, 13% met Medicare coverage rules. In other words, these services likely would have been approved for these beneficiaries under original Medicare. And 18% of payment denials met Medicare coverage rules and should have been granted. The report also describes the human impact of these decisions. Here are a few examples described in the report. A 72-year-old woman presented with a cancerous breast tumor, and the Medicare Advantage plan denied her breast reconstruction surgery, stating that the service was not covered. A Medicare Advantage plan refused to pay $150 a month for a hospital bed with rails, even though a 93-year-old patient had a history of epilepsy, early onset Alzheimer's, rheumatoid arthritis, chronic back pain, knee and joint stiffness, and limited range of motion. However, the Health and Human Services and the Office of Inspector General's medical experts determined that this bed request was medically necessary due to the beneficiary's chronic conditions and movement limitations. A Medicare Advantage plan also refused to admit a 67-year-old patient to an inpatient rehabilitation facility, even though he presented with an acute right-sided ischemic stroke and was seen at the emergency department with new onset slurred speech. The beneficiary had difficulty swallowing, was at significant risk of aspiration and fluid penetration, at high risk for pneumonia, and therefore, according to the Medicare Benefit Policy Manual, should have been under the frequent supervision of a rehabilitation physician. And just recently, I had someone call me in distress because her husband had a stroke and is bedridden, and his Medicare Advantage plan sent him home from the hospital instead of to a skilled nursing facility. Unfortunately, his wife is recovering from knee replacement surgery and is not capable of helping her husband out of bed. So this causes even more issues. And the couple did try appealing the plan's denial to send him to a skilled nursing facility, but it was rejected by the Medicare Advantage Plan. Someone did advise him to go back on original Medicare, which is why they called me. But I had to have a very difficult conversation with him about how he can go back to original Medicare, but he won't medically qualify for Medicare's supplement plan due to his health situation, therefore leaving him financially vulnerable to high out-of-pocket costs. So for this gentleman, his options are extremely limited, and he will have to continue fighting with his Medicare Advantage plan to get the care he needs. Now, if he was able to qualify medically, then I would have advised him to go back to his original Medicare and add a Medigap plan to help cover the cost of all of his Medicare-approved services. A Medigap plan, which is also known as a Medicare supplement plan, allows you to visit any provider in the United States and U.S. territories that accepts Medicare, and it will help cover the cost of Medicare-approved services. The plan with the most coverage will minimize your out-of-pocket exposure to Medicare's Part B deductible, which is $233 in 2022 and projected to stay at $233 in 2023, according to the Medicare Trustees Report. To learn more about Medicare supplement plans, please watch more of my videos, visit my website, or feel free to contact me to discuss your situation. As always, thanks for being here today, and I'll see you next time. Bye for now. No ums. This is moving so slow. No. Oh, wait. See? Yeah, that one. Let's just do that one again. Oh, so see? Yeah, I say that there.